Good afternoon, everyone, and thank you again for joining us for today's webinar, Balancing the Sound Rationale for Smoke-Free Housing with Tenant Concerns. Today's presenters are Diana Myers and Chris Galata. Diana has over 45 years of experience in the field of housing and community development as consultant, director of private and public agencies, and through university and government-related research and training. She holds a BA and master's degree in city planning from the University of Pennsylvania. Ms. Myers founded Diana T. Myers and Associates, Inc., DMA, in 1988 and is now the senior vice president. The firm specializes in expanding affordable housing opportunities for individuals with special needs through policy formulation, program design, and development consulting. While at DMA, Ms. Myers has worked extensively with public agencies and private nonprofits to prevent and end homelessness and to create innovative housing options for seniors and individuals with disabilities. For these efforts, she received the Partnership Award from the Housing Alliance of Pennsylvania in December of 2007. DMA has been working with the Health Promotion Council to provide technical assistance on smoke-free housing since 2016. Christopher Galata served as the Executive Director of the Redevelopment and Housing Authorities of Cumberland County for 30 years until his retirement in November 2010. As Executive Director, Mr. Galata oversaw the authority's community development and affordable housing initiatives. In December 2010, Mr. Galata formed the Galata Group LLC, a firm specializing in training, technical assistance, and strategic planning for community development and housing organizations. Clients have included the Downtown Carlisle Association, Housing Alliance of Pennsylvania, Sinking Spring Borough, Housing Authority of Northumberland County, the Keene County Redevelopment and Housing Authorities, Lancaster County Redevelopment and Housing Authorities, City of Johnstown, City of Bradford, Reading Redevelopment Authority, PA State Association of Boroughs, and Pennsylvania Economic Development Association. Mr. Galata has worked as a subcontractor to Diana T. Myers and Associates on smoke-free housing issues since November 2016. Mr. Galata is a graduate of Dickinson College in Carlisle, PA, and the Pennsylvania State Harrisburg Master's Degree Program in Urban and Regional Planning and the Dickinson College School of Law. Thank you both for joining us today, and I'll hand the presentation over to you.
Thank you. And I would like to thank the Housing Alliance of Pennsylvania for this opportunity to present the webinar today. It's a subject near and dear to me, and many of you have been hearing more and more about housing as a social determinant of health, and the work we've been doing on helping to help multi-unit housing projects go smoke-free certainly is an example of how important that is and why we're presenting today. So thank you, Colleen. And we have a number of reasons for today for this presentation. We want, first of all, to introduce to you the Tobacco Control Project, the services that are provided under that, because many of you may be able to take advantage of those services, and we hope that you will. We want to briefly review the new HUD rule for smoke-free public housing for those of you who may not have heard about it yet. And we're going to take an opportunity also to describe the dangers of exposure to secondhand smoke. So it's not only, smoke is not only terrible for a detriment to people who smoke, but also for people who are in the same or other adjacent units sometimes of the smokers. We're also going to explain some of the health and economic benefits of smoke-free housing to the housing providers. Why is it important to you? And finally, Chris is going to present approaches for enforcing these policies that are both balance the sound rationale for smoke-free housing along with the resident concerns about smoking cessation. Okay, so the Tobacco Control Project, the Pennsylvania Department of Health is funding projects throughout the Commonwealth using their tobacco money that was coming into them, and they formed the Tobacco Control Project. And there are regional providers throughout the Commonwealth. The provider in southeastern Pennsylvania is the Health Promotion Council, which is an affiliate of Public Health Management Corporation, which many of you may be familiar with. The principals under that program for the Health Promotion Council are Sean McCormick and Jamie McGee. And the project that Chris and I are working on, which is called the Multi-Unit Housing Project, is a part of the Tobacco Control Project. That's a little information on the organization and how this all fits in. What we can do under the Multi-Unit Housing Project is many different things. We can help both in drafting and implementing policies to help multi-unit housing projects go smoke-free. We can help to draft, review, revise smoke-free policies. We have a number of good samples available. And we can help with communication plans for the staff and for the residents, including newsletter articles, notices that will go out, and so forth. And very importantly, we can help with the strategic implementation of how to plan to implement the projects, to set up a schedule for when the project would be, the smoke-free policy would be implemented. We're recommending generally 6 months from the time that the policy is adopted to the actual time it's implemented to give the residents enough time to take advantage of smoking cessation programs, etc. We can help with those notices, the lease addendums that are required, at least by HUD, or either lease addendums or house rules that would actually be the way that the residents would be committed to abiding by the new policy. And we can help with procedures to establish violation of the rules and the various language for contractors, since it applies not only just to residents and staff, but also contractors and guests that come into the building. So we can also provide access, and that's what Chris and I are doing, but we can also link you with regional service providers who provide the smoking cessation classes and on-site services. So once a policy is adopted, obviously the important part is to try to help residents who want to stop smoking to do that. And so we can provide information through these other agencies that we can link you with through the dangers of smoking in multi-unit housing, tobacco, nicotine, and vaping education, various information sessions on what resources are available for smoking cessation, and on-site no-cost smoking cessation programs. I believe they have an 8-week program that's available. And finally, connection to the 1-800-QUIT-NOW, which has a variety of resources, including access to smoking patches, no smoking patches. Okay, so I'm going to present, just to make it a little more interesting, I hope, some myths or versus facts about smoke-free housing and about smoking. And then as we go through the PowerPoint today, we will come up with the answers to these particular myths or facts. Tobacco use is the leading cause of preventable illness and death in the United States. HUD has passed a rule prohibiting smoking in all HUD-funded properties. Secondhand smoke can be safely prevented from drifting between units. Fire caused by smoking is the leading cause of deaths in residential units. An individual can smoke in his or her unit in smoke-free housing as a reasonable accommodation if that person has a certified disability. And in many cases, even smokers prefer to live in smoke-free buildings. So here's a number of facts or myths that we'll find out which they are. So next on to the HUD's rule, which was passed and it became effective February 3rd, 2017, requiring that all public housing authorities adopt a smoke-free policy for public housing by July 30th, I think it's July 31st actually, 2018. Okay, so it's a policy that is, it's a policy only for public housing at this point. So that's the first myth. It covers both scattered site and single-family properties that are owned and operated by the public housing authorities. And the rules apply to both tenants, guests, staff, and contractors, as I said a minute ago. It will be included in a tenant lease, amendment, addendum, house rules, whatever that are acknowledged and signed by the tenant. The housing authority must give the tenants at least 60 days notice for the effect taking place of the policy, and the policy has to include the date it takes effect. The policy must prohibit the use of prohibited tobacco products in all indoor areas and outdoor areas, including the indoor areas include living units, hallways, common areas, the admin offices, community centers, daycare centers, laundry centers. Any uses within the building are included and covered by the policy. So there is no smoking within the walls. In addition, there are restrictions about smoking in the outdoor areas. It's prohibited in outdoor areas within 25 feet of the housing and administration buildings or property line. And that's if it's less than 25 feet, it would be just the property line. The perimeter also would include balconies, porches, decks, other outdoor spaces within that 25-foot boundary. However, if the PHA does want to, they can create other smoke-free areas outside the perimeter, such as playgrounds. They have some discretion to do that. The HUD rule is really providing the minimum requirements. If the PHA wants to go beyond that, they can do that. And in some cases, they have. The prohibited products include water pipes, the old 60s folks like Chris and I, hookahs, items involving any ignition and burning of tobacco leaves, and that includes but is not limited to cigarettes, cigars, and pipes. At the current time, however, the electronic nicotine delivery systems, the vaping machines, and so forth are not covered. Okay, other smoke-free housing policies. So when Chris and I agreed to work with the Health Promotion Council on these policies, we had the idea that maybe what would be a good idea to get the funders of low and moderate income and subsidized housing to be the ones to require that it become smoke-free. We approached PHFA, and in 2017, and as part of their QAP, their Qualified Allocation Plan for 2017-18, they required that all new multi-unit housing developments funded through the Low-Income Housing Tax Credit Program be smoke-free. And that resulted in 2,000 new units being required to be smoke-free. So from now on, and then they did a brief survey of some of the developers after that to see how they felt about that policy, as well as some other things that were included in the QAP that year. And there were very few negative responses about the smoke-free policy, so they have decided to continue that again in 2018-19. PHFA this week is also sending out a letter that's going to encourage developers of the existing owners and managers of the existing PHFA-funded developments to go smoke-free, and will offer technical assistance through the Health Promotion Council, through the smoke-free projects, and other people in other states. The Federal Home Loan Bank in Pittsburgh also responded to us. Now, they have other issues because they cover many states, not just Pennsylvania, but however, they did agree to include information under their best practices section of the 2018 implementation plan that encourages all projects to go smoke-free. So if you're not a PHA, why should you voluntarily make your building smoke-free? Because you don't have to, right? So what are some of the reasons for that? Okay, let's get back to some of those myths. Smoking actually is the leading cause of preventable illness and death in the United States. It harms nearly every organ in your body, and this I think is astounding. More than 10 times as many U.S. citizens have died prematurely from cigarette smoking than have died in all the wars fought by the United States. That is, to me, quite compelling reason for implementing smoke-free policies. In addition, secondhand smoke is deadly, so it's not just for the smokers. It is the secondhand smoke, which comes through the walls or is in the unit from other people who are non-smokers but living in the same home. It has more than 4,000 chemicals, and many of those chemicals are toxic and cause cancer. More than 38,000 people die annually from diseases caused just by secondhand smoke, not by smoking. And in 2006, the Surgeon General actually came up with a statement that said there are no safe levels of secondhand smoke. Okay? It increases the risk of so many things. The obvious ones that we all hear about are lung cancer and emphysema, but secondhand smoke increases exposure, heart disease, bronchitis, sudden SIDS, which I found surprising, low birth weight, preterm babies, asthma, which can be really controlled if in the proper environment, but in a smoke where there's secondhand smoke can become much more severe. Ear infections, nosebleeds, it just has an incredible range of negative impacts. And third-hand smoke also includes toxins, and that remains. So even when a unit is made smoke-free and certain steps are taken, it still can be found. Smoke, the detriments, these chemicals can still be found in clothing, furniture, curtains, carpeting, and other aspects of the home. So there is a huge health impact in multi-unit housing, particularly. That means a lot of people. There's more than 54 million people in the U.S. that live in rented multi-unit housing. And again, the smoke drifts from one unit to other, making it dangerous for renters, guests, staff, etc. And as not surprisingly, the most vulnerable to the risks of secondhand smoke are children, older adults, and lower income people who are actually more likely to smoke also. Okay, so and what's interesting, here's one of the other interesting, not myths, the fact is that the studies have found there's an increasing majority of residents, even those who smoke, that prefer smoke-free housing. Cambridge Housing Authority in Massachusetts found 79% of its residents would prefer to live in smoke-free housing. In Columbus, Ohio, more than 50% of the residents in subsidized multifamily housing said they support complete smoking ban indoors. In Oregon, there was a statewide study that found that more than 70% of renters preferred smoke-free housing. And in Nebraska, more than 70% of renters would prefer smoke-free housing over housing that allowed smoking indoors. Okay, finally, we have found that there is an impact for the housing providers. There's, in addition to them trying to promote the health benefits of no smoking, there are really some financial benefits to the owners and managers of that housing. In smoke-free housing, for every 10 public housing unit turnovers, there can be a saving of at least $12,500 in maintenance costs. And with the budgets, with the limited budgets that people have today, I think that can be really effective, especially if they have a larger property. Fire caused by smoking is indeed the leading cause of deaths in residential unit. It accounts for 7% of all fires in those units, and that is the leading cause of death. Smoke-free housing also provides an advantage in terms of marketing properties. As we can see, since people prefer smoke-free housing, it can be a wonderful marketing tool to say your housing is smoke-free and would attract more people. Finally, turnover in smoke-free housing is less because since people prefer smoke-free housing, the residents tend to be happier in that housing. I think there's one thing that I skipped over somewhere, but just to say that Chris and I are working with southeastern Pennsylvania, and it's the 7 southeastern Pennsylvania counties except for Philadelphia. And however, there are regional providers, primary regional providers throughout the state that are funded also through the Department of Health. And if people are in other parts of the state and would like to take advantage of the technical assistance, we can provide you with that list of contractors in other parts. Please just get in touch with myself or Chris. And speaking of Chris, I'm going to turn this over now to Chris, who's going to talk about the challenges and strategies for addressing those challenges.
Thanks, Diana, and good afternoon, everyone. Diane, I'm going to rely on you to move the slides. I don't seem to have the controls, but I do have the slides here, so I'll be going through them.
Oh, good.
Yeah, I'm going to be talking about typical challenges faced by housing providers. And For those of you that aren't associated with public housing agencies, and specifically those of you that are not involved in the implementation of this mandated smoke-free rule, you may be thinking about going smoke-free, or maybe your development has already gone smoke-free. And as you know, there are a number of lease enforcement issues that you may encounter in going smoke-free, and my presentation is really going to be a discussion of some of these challenges. I know that housing providers, whether you're public housing or HUD-assisted housing, you are concerned about losing tenants who cannot or refuse to abide by the policy, and you may be concerned about the difficulty encountered in marketing the property to new tenants because of the smoke-free policy. Hopefully Diana's presentation allayed some of those concerns. You may be concerned about having difficulty in enforcing the smoke-free policy, emphasis on the word enforcement there, and you may have a concern about the impact of the smoke-free policy, what that impact will be on vulnerable populations such as persons with behavioral health disabilities, seniors, persons with addictions, and recently homeless individuals. And really what we're looking at talking to you about today is there's a legitimate rationale, public health rationale, and a financial rationale for going smoke-free, which is why many of you who are not public housing have already done so, and why you may be contemplating going smoke-free. But the balancing act here is how do you do this and make sure that you are responsive to tenant concerns. So this first challenge, the challenge of or the perception that you may lose tenants who can't abide by the policy, and you may have difficulty marketing the property to new tenants because of the smoke-free policy. Let me talk about that a little bit. What we are seeing is when the percentage of smokers in a building is lower, that the implementation of a smoke-free policy seems to be easier because of peer pressure and the fact that the majority, and sometimes the vast majority, of the tenants who are not smokers will that will work in favor of you in terms of those folks exerting peer pressure on those who are smokers. However, in a lot of buildings in Pennsylvania, particularly in the central part of the state, in the western part of the state, and to a certain extent in the northeast part of the state, the percentages of smokers, the percentage is higher. And when you have that situation, it can make for a challenging situation, particularly when it comes to lease enforcement. The key here is to make sure that you're involving all staff at an early stage. If you decide that you want to move ahead with a smoke-free policy, you need to involve the staff. And by staff, I'm not just limiting that to property managers, but maintenance staff as well, because it's important that what maintenance staff says about the policy and the implementation of the policy, that syncs up with not only what property managers are saying, but the policy overall of the owner with regard to smoke-free housing. So training is essential. It should cover all the details of the new policy. And then this next point is extremely important, how to communicate the policy and how to message the new policy with the tenants. And the communication and the messaging of the smoke-free policy is very important, and we're going to talk more about that. Next slide. The policy should be presented in non-judgmental terms with an emphasis on the reality of smoking as an addiction and the point that smokers are arguably the victims of policies that have encouraged tobacco production and consumption. So here are some examples of positive messaging. You'll live longer and be there for your grandchildren when they graduate and marry. Smoking is expensive. Quitting can save you up to $2,500 a year. And smoking can be expensive in terms of damage to your unit, such as burn holes on carpet and countertops. So these positive messages, I think, are important. And when you read the literature on this, there is a discussion about making sure that you are messaging this in a positive way. Now, having said that, we all watch television. We know that the TV ads are geared toward really scaring people about the dangers of smoking. And I'm not being critical of those ads. I think there's a place for that. But in, I think, a housing management situation where you're managing housing, you're the owner, you're representing the owner, and trying to build a relationship with a tenant. I don't think scaring the tenants is the way to approach this. I think, again, the positive messaging is a better approach at this level. Examples of communicating with empathy, and this is important as well, because your success rate in terms of, and by success rate, obviously the goal is to have the building smoke-free, but your success rate in terms of having few, if any, lease violation issues, that's how I define success, will very much depend on, again, this positive messaging and also communicating with empathy. And some messages that I think reflect an empathetic approach would include, I've never been a smoker, and I can't imagine how difficult it must be to quit. I smoked at one time and know how difficult this may be for you if you have smoked. And then some questions. What concerns do you have about the new policy? How can I help you? And I think Diana mentioned the availability of smoking cessation classes that are available throughout the Commonwealth of Pennsylvania at no cost that can help people through this transition and hopefully transition to the point where they're smoke-free. So those services are available. It is important that you listen to tenant concerns. To the extent that you do, I think that you'll be able to work through what concerns they may have about the policy. I'm not saying that's the case always, but I think in the vast majority of cases that's going to be the case. Next slide. The second challenge, which is the concern about the difficulty in enforcing the smoke-free policy. And I should have probably started out by saying that a lot of the thinking that is referenced in my slides is included in a draft, at this point, a draft lease enforcement policy that hopefully will be made public in early July, recognizing as a former property manager and owner at the redevelopment and housing authorities that this is a difficult lease enforcement issue for you. I don't think we want to downplay that, but how can you have greater success? And that first series of slides that I covered talks about the importance of training staff and messaging and communicating with empathy. The second concern deals specifically with the difficulty of enforcing the policy. And there has been some indication based on the implementation of the smoke-free policies by housing authorities that to the extent that tenants are included early in the process, and what do I mean by that? At least 6 months before the policy takes effect. And one of the things I recommend is that when you have meetings with tenants, that you maybe have a maximum of 20 to 25 people at each meeting, so that if someone has a concern about the policy, or even 2 people or 3 people, it's 2 or 3 people, it's not 30 people. So I really believe in breaking down or chunking this in the sense that you would have, if you have a building of 100 people, you may want to have 4 tenant meetings and limit the size of those meetings to 25 people. Because the dynamics of a meeting consisting of 25 tenants is very different than the dynamics of a meeting that would have tenants in it, particularly if some of the tenants who are having problems with the policy are verbal. So you can include tenants in the process, but you want to think about how you handle tenant participation at those meetings. You want someone at those meetings who has listening skills, who can lead that meeting. And that may be a property manager, but maybe it isn't. Maybe there's someone within the organization that is a good facilitator, that has good listening skills, that can essentially make sure that meeting runs smoothly. And by that I mean you're not necessarily, that you will not, should not necessarily try to quell any tenant concerns. You want to make sure those concerns come out at the meeting, but you certainly want to take some time to address those concerns. But to the extent that this meeting with tenants is well facilitated and there's some active listening deployed, and by that I mean, I think many of you know what I mean by active listening. When someone makes a point, you kind of restate it in your words so that they know that you are listening to them, which helps a great deal in terms of the tenant maybe getting upset because they know they're being listened to. But the second key here about enforcement is implementing the smoke-free policy thoughtfully. And if I could have the next slide. And I talked about including tenants early in the process, communicating the policy and the rationale. And that's important, both the public health rationale and the financial rationale. And I talked about the point positive and empathetic messages, emphasizing the availability of tobacco dependency treatment. And also what I haven't talked about is clarifying what tenants should expect in terms of enforcement. And if you can go to the next slide, I'll get into that a little bit. Implementing the smoke-free policy thoughtfully means adhering to some overarching ideals, enforcing the policy in a consistent manner. And one of the keys to success is whether you do enforce this policy consistently or whether you overlook infractions. And if you overlook infractions, you really don't have a smoke-free building. And I know that property managers and service coordinators have a lot on their plate, and there may be a tendency to try to overlook infractions, but believe me, if one or two people get away with something, then everyone will try to get away with it, and you will not really have effectively implemented a smoke-free policy. So again, these are overarching ideals, employing empathy, providing support, seeking fairness. And to the extent that you have those as ideals, I think your policy will be enforced in a manner that is respectful of tenant concerns, but also recognizes the importance of having a smoke-free building. Next slide. Tenants should be required to sign a lease addendum. Key provisions in that addendum would be that residents are responsible for the actions of their household, guests, and visitors. And by the way, management needs to make sure that anyone coming into the building doing work on the building, contractors, that management employees, or even service personnel that are providing services to tenants, aides that are coming into the building from visiting nurse associations, they're subject to this policy as well. So there are no exceptions to this policy. It's not just tenants. Their guests and visitors. It's really anyone who is in the building, including staff, all staff, and anyone who's in the building for whatever reason. It is important to include a clause in the lease addendum that management does not guarantee the residents' health or the smoke-free condition of the property. And despite your best efforts, let's be honest, you will have people occasionally try to test you and smoke. And you don't want to indicate to any non-smoking tenant that you're going to guarantee their health, that you're never going to have a situation where someone smokes in the building, even though you're enforcing the policy rigorously. So you want to make sure, again, because of legal issues, that you have that language that you're not guaranteeing the resident's health or the smoke-free condition of the property. Obviously, you're going to make best efforts to enforce a smoke-free policy. This next point is very, very important, and this is really part of the messaging. The message you want to make sure people understand, tenants understand, is that you're not requiring the resident to quit smoking. You're simply not going to allow them to smoke in the building, and if it's your choice to limit smoking within a 20-foot radius, you're not going to allow them to smoke in that radius as well. They can continue to smoke. They can smoke in public. If management's decision is to not have an area on the property outside of that 25-foot radius where they can smoke, that they would have to smoke on a public sidewalk or some sort of public right-of-way, they can still do that. It's just that they can't smoke in designated areas, which is the building exterior areas that are proximate to the building. In terms of how you handle the compliance, I think it's important to have a tiered approach, and those that have implemented smoke-free policies, I think, have used this tiered approach effectively. The first violation being a written warning letter enclosing smoking cessation materials. So, the first violation, you want to give people the benefit of the doubt. You certainly want to give them a warning letter, but also make sure they know about the availability of smoking cessation services. If there's a violation, again, a second violation, you would send them a lease violation notice with a 30-day notice with option to remedy, giving them essentially a second chance to pull it together. And then if there is a third violation, a lease termination notice is sent out. Enforcement of a non-smoking policy can be frustrating. However, staff will be helped if there's a written procedure for documenting violations. And the draft lease enforcement guide that should be available on or about July 1st has a protocol for how you document violations, smoking violations, how you document those violations at initial move-in, how you document those violations at the annual inspection, and how you document any violations that would occur between annual inspections. And so you need a policy, a protocol, if you will, to do that. Typically, that protocol includes a written documentation of what staff is seeing in the apartment or what staff has been told by the tenant or others. I'm a big believer that if you do get notice that a tenant's been smoking and would go into their apartment to see whether that's the case, that you have a second employee of management there to witness what you're witnessing, including any comments made by the tenant, either acknowledging that they have been smoking or also acknowledging if they're denying that they have been smoking. So more people who can corroborate what's happening so it doesn't become a he said, she said type of thing. You actually have two people from management who can document what was said and what was seen. Photographs are important. You've heard the saying, a picture is worth 1,000 words. So if you have burn marks on countertops, burn marks on carpets, burn mark on a porcelain sink, all of these are pretty compelling that smoking has occurred, particularly if you document it at the initial move-in that those marks were not there. Next slide. This third concern, this third challenge, which arguably may be the biggest challenge for housing managers that are implementing this policy, is to make sure that they're doing this, implementing the policy, in a way that really acknowledges that vulnerable populations, such as persons with behavioral health disabilities, seniors, persons with addictions, and recently homeless, really acknowledging that those populations may have more difficulty in accepting this policy if they're smokers and complying with the policy. And the point here is that since rules, policies, practices, and services may have a different effect on persons with disabilities than others, treating persons with disabilities exactly the same as others will sometimes deny them an equal opportunity to use and enjoy a dwelling. Next slide, please. It is possible for a household with a disabled person to make a request for reasonable accommodation, but never, ever should that reasonable accommodation be allowing them to smoke in a restricted area. Never. In fact, the HUD guidance given to housing authorities, HUD Notice 2017.3, makes it very clear that that is not an acceptable reasonable accommodation. Reasonable accommodations that are acceptable would be relocating the tenant to an exit door closer to the designated smoking area or a public space where smoking is allowed. If there is an area outside of the 25-foot radius where smoking is allowed, making sure that there's an accessible walkway, possibly a cover over that, cover over the area where smoking is occurring, and some lighting and seating, but that's not required, but it must be accessible. In other words, if you have a concrete pad, and you could satisfy this requirement by simply having a concrete pad, you want to make sure the walkway going to that concrete pad is accessible. And then finally, and this is very, very important, including family and social service staff to discuss the policy with individuals who have cognitive impairments. These are folks that simply maybe truly understand what the policy is and why management is electing to implement this policy. I'm a big believer that when family members are helpful, I know that's not always the case, but I think property managers and supportive service coordinators know when property members may be helpful. They also know when property members may not be helpful under certain circumstances. But if a family member can be brought into essentially a team of people, to be part of a team of people that will be working with that vulnerable tenant, and the other people on that team, if they're in the MH system or the drug and alcohol system, if they have a case manager that is working with that person, they should be part of the team. Certainly the service coordinator at the property should be part of the team. And essentially what you're doing, when all is said and done, is really developing a service plan specifically to deal with this issue of getting this person through this transition from smoking in the building to either giving up smoking or understanding that they need to smoke outside of a restricted area. So in order to accomplish that, you need to recognize people who where it may be particularly difficult, in all candor through no fault of their own, in accepting this policy. And you acknowledge that and you address it by essentially making sure you have a team of people working with them so that you avoid at all costs an eviction in that case. Next slide. So, Diana, I guess you want to wrap up?
Sure. Well, I basically wanted to say thank you again for the opportunity. We have, looks like 10 or 15 minutes for questions. I think, I guess, Colleen, can you unmute people, and or we have the chat box to the lower left of the slides if you want to write something. And Chris and I would be happy to answer any questions. Also, if you would like a copy of the Regional Contractors list, the primary contractors, send a quick email to either me or I wrote Sean, sorry. It should be Chris's information there. I guess you should send it to me, and I will send it to you.
Great.
So we are open for questions.
Yep,
comments.
If anybody has any questions or comments, you can unmute your line by clicking *7 on your phone keypad, and that will allow you to ask your question.
And, of course, thank you, Colleen, for your assistance with this. It's been invaluable.
I have a question. Can you all hear me?
Yep, we can.
Mm-hmm.
Okay, my name is Ali Abdullah, and I'm the Disability Compliance Administrator here at the Housing Authority City of Pittsburgh. And so I wanted to know, I know it mentioned public housing. This applies to public housing as it relates to scattered sites and things of that nature. Does it also apply to housing that will fall under the Section 8 or Housing Choice Voucher Program?
It does not.
Not at this point, no.
Right.
Okay. And are you able to, I know you gave some examples as it relates to reasonable accommodation for persons with disabilities or, things of that nature. Have you seen any difficulties or seen situations where basically that has occurred as of yet and what that looks like?
Yeah, I know that there was one request in southeastern Pennsylvania on the part of a tenant for reasonable accommodation to allow them to smoke in a restricted area, and they actually had a letter from their doctor indicating that they needed to smoke in order to, I guess, ease anxiety and stress. And but clearly, when you read 2017 PIH Notice 2017-3, that's not a permissible reasonable accommodation. So I think the ones that I did mention are the typical reasonable accommodations that are granted, and there may be others. I'll be very candid. This is still relatively new. And
yeah, I was about to say.
Yeah, housing authorities and actually the disability rights organizations may come up with other reasonable accommodations, short of allowing a person to smoke in a restricted area, that may be really good reasonable accommodations. So I think time will tell.
Yeah, I think I'm been curious about this whole topic just because, and even in the context of, I guess what you said they established there. You said it was 2017. You said.
It's HUD notice PIH 2017-3.
-3. So, because that's the whole point is people were asked an exception to, the rule, practice, or policy. Mm-hmm. So I know that's what they wrote, but people probably will ask for that anyway. Like, I need to be able to smoke in a restricted area. I could just see that happening due to this.
Yeah, I think you need to hang tough on that point and take a look at that notice, and the notice provides pretty clear guidance to that effect.
Right. Yeah, no, I appreciate that. That's all the questions I had.
Mm-hmm.
Great, thank you. And we have a few more minutes for questions, so if you'd like to ask any questions, you can unmute yourself by clicking *7 or typing them in the chat box in the bottom left-hand corner of your screen.
We were extremely clear, and everybody agrees with the policy.
Diane, let me ask you a question. Lease enforcement guide. Have you thought about how we're going to make that available? Will that be up on the SEPA website? And
yes,
how else
it
will
will.
We make folks aware of that?
It will be available on the website, and I think we will also make a number of copies available in hard copies for when we go make presentations and things, so we can hand some things out. So, of course, anybody can print it off from the electronic version. But we will also have a number of hard copies. And I think it's a terrific document that Chris put together. It'll be very helpful. We've had a couple property managers review it for us and give us some feedback, and they've all found it extremely helpful. Oh, here we go. We got to thank you. You're welcome.
Well, if there are no more questions for the webinar, we're just going to end today's webinar, and I want to thank Diana and Chris again for presenting this information, and thank you all for attending, and have a great rest of your week, and happy weekend.
Thank you. Same to you.
You too. Bye now.